Hello everyone, today I'm going to be talking about the characteristics of autism spectrum disorder. Autism spectrum disorder is a wide range disorder with a variety of characteristics. Some of those characteristics present themselves through cognitive, neurological, behavioral, sensory, communicative, and social aspects. Cognitive characteristics may appear as low IQ, deficiency in theory of mind, which would be seeing things from other perspectives, difficulty with executive functioning, planning, attention shift are some examples of those, and visual strength. That's why a lot of students with autism benefit from things such as pictorial icons. Neurological characteristics would be motor impairment, which could be dyspraxia, developmental delays, gait impairments, some sleep disorders, insomnia, melatonin regulation, and epilepsy. A few behavioral characteristics would be repetitive behaviors. This may look like hand flapping, hand wringing, rocking. Some restrictive behaviors would be object attachment. They tend to attach themselves to objects that spin, have glitter, a specific toy, oftentimes stones or things that are made of plastic. And they also have an intense focus on these tasks or objects. They have a hard time stopping interacting with these objects and moving on to something else. A lot of times they'll line up their toys in a certain pattern or in a certain order. They have a need for structure and consistent routine. It's extremely important for them that they know what's going to happen every day, what's going to happen next, what they did before. A lot of them strive off of visual schedules because they have a visual skill strength of pictorial icons, and so having that visual schedule for them and that constant routine establishes the structure. They also have a lot of abnormal eating and sleeping patterns. Most individuals with autism spectrum disorder are extremely picky eaters. Some sensory characteristics would be hypersensitivity to things like touch or smell. They also could be hyposensitive, which would be being undersensitive to things like voice, tone of voice, oftentimes their parent's voice. They may not respond to a parent's voice right away. All 5 senses are affected in different ways and sometimes often can be combined. A child or an individual may have hypersensitivity with some senses and hyposensitivity with others. Communication and language characteristics would be a deviation in language development. This could look like echolalia, which would be echoing what a person is telling them. So if I told a student, "Wait, please," they would echo back, "Wait, please." Palalia would be repeating their own words. This often could be a song that they hear, or when they verbalize something, they could just be repeating it over and over again. Echopraxia would be repeats movements or gestures. Neologism would be they're using their made-up words, so it may not make sense to others. It's kind of their own language that they've developed for themselves. They also have a deviation in communicative intent, so the difficulty to understand the intent of a conversation, which could be like the sarcasm or the mood or the tone of voice that somebody is using when they're talking. They may also have difficulty with communication skills, such as making eye contact with the person while they're talking, carrying on that conversation after a question has been asked. They have difficulty figuring out another question to keep that conversation moving. And some may be nonverbal at all. And oftentimes those that are nonverbal use AAC devices, which could look like pictorial icons. It could look like sign language. Some of them use an iPad with a system on it that uses pictorial icons to voice their needs. A PEX board, which would be similar to using an iPad with pictorial needs. There's different forms of that, so it could be in a binder with actual icons that they're manipulating around. It could be a digital app. So there's a lot of different ways an AAC device could be portrayed, and it kind of just depends on the student or the individual's needs and what they gravitate towards that works best for them. Social characteristics in individuals with autism spectrum disorder would be difficulties with social interactions, such as eye contact, physical touch, interpreting facial expression, and lack of responsive voice tone. I often see social interaction as a high difficulty in a lot of individuals with autism that I've worked with. I've also seen some that prefer the physical touch when they're overstimulated. Some like the pressure of physical touch or to make eye contact with you. A lot of these characteristics differ from person to person, and along with social characteristics, they have difficulties establishing relationships, which tends to lead to a lack of friends. At the end of this slide, I have attached all of my references that I have used for all the information that I have talked about. Thanks for listening. Those are the characteristics of autism spectrum disorder.